Is it? Well, here to discuss your Healthcare Playbook, author Dennis Deruelle, who, by the way, is working with Senator Cassidy on this bill. Also with us, Michael Barnes, a former George W. Bush policy advisor. Dr. Dennis, here's the thing. There's always confusion when these bills are presented, even when there's time to read them. A lot of folks are saying they're going to vote on this. Most of these senators won't be truly educated on it. So what are the real bullet points the American public should understand why this will be better than Obamacare?
Well, the first thing is that in medicine, we have something called cookbook medicine, where you do the same thing for every patient. You can't do that. You have to individualize for every single patient because they're unique. Healthcare in every state is the same way. Each state has a different population. This bill is going to take the money, and instead of mandating one or two options that you could have under Affordable Care Act, and let states do whatever they want to innovate and give the care to the patients and the people in their states that they need. I think that's one of the key elements of this. It also does away with the individual mandate, which did not work, does away with the employer mandate, which did not work, and it's going to give actual formulas that will give Medicaid money in a way that's more fair than the way it's been dispersed right now under the Affordable Care Act.
Well, Michael, let's talk about the four-letter word here, cash. A lot of these states are saying, hey, at some point, the money that we're getting from Medicaid is going to dry up, particularly the Medicaid expansion. A lot of these states, including a lot of red states, have gone into this very deeply, and they are afraid of that funding ever drying up, of the state itself having to come up with those funds. They are definitely afraid of that.
Yes, and what's most important, Charles, is that the states that have been hit hardest by the drug overdose epidemic are the ones that are also going to be hurt worse by this bill if it were to become law. So that includes Indiana, Ohio, West Virginia, and Pennsylvania. And there's an important thing to note here. As Republicans, you have to recognize that some of the best well-known Republican governors in the United States have come out against this bill, which reverts back to the states. So we've got John Kasich, Brian Sandoval, Larry Hogan, and other great Republicans who are saying, wait a second, this is not going to be good for our states. It's not good for the nation. The most important thing to Dr. Dennis is you cannot individualize health care if they are not allowed to buy insurance and if insurance is not there for them when they need it. So we've got to step back and look at economics first, and economically this system is a disaster.
You want to address that?
Absolutely. I think that there's going to be plenty of money because the states that expanded Medicaid, that's going to be their baseline. And so they're going to start with this new formula on that baseline. And I would say that there's plenty of states that have actually innovated, like Oregon, and they're saving $200 million now in their programs. They're just going to have the ability to take the money that they have and innovate better. I think what you're going to see with this is something like a great race to space, basically, where states are going to innovate for a better quality of care and higher value.
They could do that under current law with reforms. It's important to note that states proved that largely they were incapable of protecting consumers from big insurance prior to the ACA. That's why
Although,
these
Michael, with all due respect, when you're the states and you know the money is coming from D.C., there's not a lot of accountability. When you get a set amount of money, you sort of budget it a lot better. But I have to ask about the debate about pre-existing conditions. I guess there's a waiver section, Section 106, about waivers. Some people are wondering if that will allow these states, not the federal government, but these states to get rid of people with pre-existing conditions. That's another fear, particularly for moderate Republicans.
It does. From a legal perspective, again, it's really a disastrous setup because it creates this amorphous standard of affordability that is not going to be enforceable if this becomes law. And so states effectively will be able to exclude people who have pre-existing conditions. There will not be mandates for coverage of conditions like mental health disorders and addiction. Even prescription medications would not be mandated as part of insurance coverage under this potential law. It's really
real quick,
bad
Dr.
idea.
Dennis. I'm getting a wrap, but I see you shaking your head. You're saying that's wrong.
No, listen, it's only for insurers to get money from grants. Those are the only people that could even begin to pair into this, and it still has to be adequate and affordable. Most Americans are still going to have all the protections here.
All right, guys, let's leave it there. Gentlemen, great stuff.